The mission of the Armstrong-Indiana-Clarion Drug and Alcohol Commission is to address the abuse and destructive effects of alcohol, tobacco, and other drugs through prevention, intervention, treatment, and case management. The largest substance abuse problem that we're facing in our area and mostly across the United States is the abuse of opiates, including the use now of fentanyl that's being laced in a number of other drugs. There are also a lot of people that come to see us for the alcohol use and abuse, and also marijuana and methamphetamines in our area is popular. We want to share with you 3 innovative programs that we've started in our county to address the effects of substance use disorders. The first one is the ARMOT program, which stands for the Addiction Recovery Mobile Outreach Team, where we have embedded a full-time case manager and a full-time certified recovery specialist who is a person in long-term recovery themselves into 2 of our hospitals.
So that model of the ARMOT team is to help meet the patient in real time and help them motivate towards some level of change, at least to help them realize what's available. At any point when a medical staff identifies that the substance use disorder might be a concern or a need or something that's impacting them, they can make a referral.
Having a person right here on site is the best that could happen for a person. They're having staff that are accessible, who can answer questions when the questions are being asked, not having to defend their reason for needing services and care, knowing what the resources are there and having to be able to provide those resources. That has helped our patients tremendously.
Near the end, my addiction was getting so bad. I had been going to the hospital a lot. They would send somebody into my room trying to, talk to me about going to treatment. They remained persistent and kept coming back and just wouldn't give up on me. And I really appreciated that because the life that I have now is just amazing. The most helpful thing to me in my journey into recovery was the caring that was shown to me, the persistence that was shown to me. They never gave up. My life today is amazing. I've rekindled the relationships with my son and my mother and my siblings. It's just amazing what recovery has done for me.
ARMOT's difference for us has been accessibility, reliability. They have provided education to patients, staff, family members.
Of the people that agree to have an assessment by one of our case managers while they're in the hospital, 93% of those people go to treatment after their discharge from the hospital. 93%. So we have a great outcome for the ARMOT program. Our second program, the 24-hour warm line, was set up in response to our first responders and our hospitals, requesting that we provide a 24/7 resource to them to call whenever the ARMOT team is not in the hospital, or first responders having somebody at a scene that needs to talk with someone further and get the help more than they can provide.
Prior to that, we were a Monday through Friday organization that was open 8 to 4. So if somebody wanted help on Friday afternoon at 4:30, they would have to wait until Monday morning at 8 to call and get in touch with somebody, to talk to a real person. Me, myself, as a person in recovery, I can talk to somebody that's struggling with addiction and let them know, this is what I did to start my recovery process. This is what was helpful for me. This is what it looked like. This is what you can expect when you go to treatment. I think it just feels different when you're talking to somebody that's been through it rather than somebody that, may have the clinical experience but doesn't have that personal knowledge or expertise.
So since 2017, we've had over 1,100 calls to our hotline. 415 of those calls were for people who requested a level of care assessment at our office. Of those calls, 82% showed up the next morning for our open appointments at our office at 9 a.m. and 3 p.m. Our third program, Harm Reduction, is also very active in our counties in helping the people that aren't ready to go to treatment, helping the people that are still using. We have that small window of opportunity where someone might accept information about how we can make their life better and change their use around substances. We have a lot of varieties of ways to get Narcan into the public's hands, and we do naloxone drive-throughs monthly in different parts of our county so that people can just pull up and be able to receive a kit easily and anonymously. Our latest venture is an outside vending machine, temperature controlled, that's located outside the emergency department of Indiana Regional Medical Center. We were recently awarded a $1 million grant from the Pennsylvania Department of Drug and Alcohol Programs to provide technical assistance to 22 other counties in western Pennsylvania to help them with their recovery support services in their counties. In the future, we'd like to help other counties and states implement this program in their area, and we are happy to provide technical assistance to anyone that's interested in doing this. Our hope for the future is to keep people alive through their recovery journeys. We like to be there before, during, and after the recovery process, so that resources are available to them. And if they're not ready for treatment, then we want to keep them alive until they're ready to go to treatment.